rami, the angle portion that joins the posterior portion of the body. Here this part are the rami of the mandible. Next is condylar process. Here is the condylar process, posterior extension of the ramus. And coronoid process is this one. This is anterior extension of the ramus. And mental symphysis or symphysis menti. Here the midline fusion point of the two halves of the mandible, that is known as symphysis menti. Okay. Symphysis pubis you have read during the pelvis. Symphysis pubis, yes or no? Okay, so this is another symphysis. Okay, symphysis menti. At the joining point of two halves of the mandible. Okay, understood? Next is different foramens and different important presenting parts we will discuss. First is mental foramen. Here, these are the mental foramens, one on each side. Okay, this transmits the mental neurovascular bundle, mental nerve and mental vessels. Alveolar process. These processes are alveolar process which forms the socket for the teeth of the lower jaw. And mandibular condyle. Condyle you have seen in previous picture. Condylar process or head of the mandible. This is rounded head of condylar process articulate with mandibular fossa of the temporal bone. Here it is articulating with the mandibular fossa of the temporal bone. Okay. Next is mandibular notch. It is the concavity between the condylar and coronoid process. Condylar process behind, coronoid process in front. There is a notch that is known as mandibular notch. Okay. Next. So mandible, it comes from the Latin word mandibular. Mandibular means jawbone. Okay. Or inferior maxillary bone is the largest, strongest and lowest bone in the face. Forms the lower jaw, holds the lower teeth in place. And it comprises of these parts: body, ramus, angle of mandible, condylar process and coronoid process. Okay, next. See here, this part, this notch is mandibular notch, I have said. Okay, posteriorly there is condylar process, anteriorly coronoid process. So this notch is known as mandibular notch, and through this notch passes the mesenteric vessels and nerves. Okay, very frequently asked in your Viva question in bone study. And mandible is very frequently given bone in your Viva table, axial skeleton. Okay. So this is mental foramen have been shown here, and here is you can see the mental protuberance near the chin. And on the two sides of the protuberance, this projecting part is the mental tubercle. These are the alveolar process having this teeth, and here inner aspect is also visible. You can see this is mandibular foramen. Okay, and from the foramen one ridge is extending downward. This is known as mylohyoid line. Above the mylohyoid line there is a depression. This is sublingual salivary gland. Other fossa is there. That is submandibular fossa. This is location for submandibular salivary glands. Okay, three pairs of salivary gland is present: parotid gland, sublingual gland, and submandibular gland. Parotid gland is located near the ear. Okay, near the temporal region, and these two are located near the mandible. Okay, the sublingual fossa and submandibular fossa. Sublingual gland and submandibular gland. Okay, understood? So this is location of sublingual fossa. Here is the submandibular fossa, and this is mandibular foramen. Through it enters the inferior alveolar nerve and vessels. Okay, enters into the mylohyoid canal. There it forms within the bone one canal, mylohyoid canal, within which it is dividing into branches. One branch is coming out through this mental foramen, that is known as mental nerve and mental vessels. Other branches are supplying the teeth of the lower jaw. Okay. And other things we have seen: coronoid process, condylar process, ramus, angle, body. All this you have seen previously. Next. So mandible is the second bone after clavicle to ossify in the body, and parts that ossify in cartilage are includes the incisive below the incisor teeth. Okay, four types of teeth are there: incisor, canine, premolar, and molar. So just below the two incisor teeth there is a fossa that is known as incisive fossa. So this part is known as incisive part below the incisor teeth. And coronal and condylar process, these parts ossify from cartilage. Okay, upper half of the ramus above the level of mandibular foramen, this also ossifying from the cartilage, and each half of the mandible ossifies from one center and which appears in the sixth week of intrauterine life in mesenchymal sheath of Meckel's cartilage. This cartilage is important. Okay, how mandible ossifies asked in your viva. Okay, it ossifies in Meckel's cartilage. Next, Meckel's cartilage has a close relationship to the mandibular nerve, and a single ossification center for each half of the mandible arises in the sixth week of intrauterine life in the region of bifurcation of the inferior alveolar nerve into mental and incisive branches. Okay, incisive branches are for the teeth, mental branches come out through the mental foramen. As the ossification continues, the Meckel's cartilage becomes surrounded and invaded by the bone. That's how the mandible is formed. Ossification stops at the site that will later become the mandibular lingula. Near the mandibular foramen, you have seen on the inner aspect of the ramus, there is a projection, bony projection. That bony projection is known as lingula of the mandible. Okay, and it is connected to the sphenoid via the sphenomandibular ligament. So lingula, from where the Meckel's cartilage continues into the middle ear and develops into the auditory ossicles, that is malleus and incus. Next, see here two inferior alveolar nerve. Their alveolar nerves are bifurcating into, this is the incisive branch and this is mental branch. Mental branch coming out through the mental foramen, incisive branch is going to supply the teeth of the lower jaw. And see, this is the Meckel's cartilage, and here the ossification centers have appeared and they are surrounding the Meckel's cartilage to form the mandible. Okay. Next. So endochondral ossification occurs in three areas of mandible. In the condylar process, ossification starts by 14th week. In the coronoid process, ossification starts by about the 10 to 14 week of intrauterine life, and in the mental region, ossification starts by 7th month of intrauterine life. And the two halves of mandibular body are united by fibrous joint at the symphysis menti, and which is replaced by bone within 2 years. 2 years after birth. Okay. Next. So these are the different borders of ramus have been shown. Ramus is a quadrangular area. It has a superior border, anterior border, posterior border, inferior border. Inferior border is continuous with the body of the mandible. Superior border, there is a notch known as mandibular notch. Posteriorly, there is condylar process of head. Anteriorly, coronoid process. Okay. And from the anterior border, one ridge is extending in front. This is known as oblique line. Oblique line is present on the outer aspect of the body of the mandible. Here is the alveolar process, mental foramen, and this is base of the mandible, inferior border of the body. Here is the angle junction between the body and the ramus, posterior border of the ramus. Okay. Next. This is the internal view you can see here. Here, roughening for attachment of the medial pterygoid muscle, one of the muscle of mastication. On the outer surface, there was masseter muscle. Okay, and here is the location of the mandibular foramen on the inner aspect of the ramus. And just guarding this foramen anteriorly, this bony projection is known as the lingula. Okay, and from this foramen, one groove is extending downward and forward. This is known as mylohyoid groove. And just above the groove, one ridge is present, that is known as mylohyoid line. Mylohyoid line gives origin to the mylohyoid muscle. And above this line, here is the sublingual fossa, and below this line, here is the mandibular fossa. And this posterior border or of the ramus, it is related to the parotid hair. Okay. Here is the head and neck of the mandible, and pterygoid fossa is also located here. Okay, understood? Okay, next. So the body of the mandible consists of a horseshoe-shaped body, has two surfaces, two borders. Two surfaces are external or outer surface or lateral surface, internal or inner surface or medial surface, and separated by two borders, upper and lower borders. Next. See, this is horseshoe-shaped body. It has a external or outer surface, internal or medial surface, and two borders. Superior border is holding the alveolar processes and teeth, and inferior border is known as the base of the mandible. Okay, understood? All those we have discussed. Okay, next. So features on the inner surface of the body. See, inner surface of the body, it contains the genial tubercles, just inner aspect of the symphysis mainly, in the midline here. Okay, on the inner aspect there are two pairs of tubercles, superior pair, inferior pair. Okay, these are known as genial tubercles. Superior genial tubercles gives origin to the genioglossus. Superiorly it is going towards the tongue, and inferior genial tubercles gives origin to the geniohyoid, going towards the hyoid bone. Okay, hyoid bone is located here. Okay, at the junction of floor of mouth and front of the neck. So there are genial tubercles, mylohyoid line. This line is mylohyoid line. Below the mylohyoid line, surface is slightly hollowed out to form the submandibular fossa layer, which lodges the submandibular gland. And above the mylohyoid line, there is sublingual fossa, which lodges the sublingual gland. Okay. And here you can see the mandibular foramen. These are parts of the ramus actually. Okay. Next. Okay, so here also you can see this mylohyoid line, sublingual fossa, submandibular fossa, alveolar process, and base of the mandible. This is base of the mandible. Next. Next we go to the borders of the mandible. Upper border or alveolar part contains 16 alveoli for the roots of the teeth, varying in size and shape, and some being multiple in number. Okay, 2 incisor, 1 canine, 2 premolar, 3 molars. Okay, these are the numbering. And lower border of the base, near the midline, the base shows a oval depression called as digastric fossa. Okay, next. अच्छा, previous stage आपको see here is the genial tubercles and here two depressions you can see. These are the digastric fossa, and this gives origin to anterior belly of the digastric muscle. Digastric muscle you will see during the anterior triangle of the neck. We will see in the dissection. Okay, so this digastric muscle have anterior belly coming from anterior aspect, another posterior belly coming from the posterior aspect. Okay, from the temporal bone, the posterior belly, and intermediate portion is joining with the hyoid bone. Okay, so that's why you have to know this important muscle, digastric muscle. Here is origin of anterior belly of digastric, from the digastric fossa. Next. Quadrilateral. So we have discussed the body of the mandible. Okay, internal surface, external surface. Next we are going towards the ramus. So ramus is quadrilateral in shape, consists of two surfaces, four borders, two processes. Two surfaces are lateral surface and medial surface. Four borders are upper border, lower border, anterior and posterior border. And two processes are coronoid process anteriorly, condylar process behind. Next. So upper border, it is thin and curved downward, forming the mandibular notch. You see the notch. Next is lower border. Lower border is backward continuation of the base of the mandible. Anterior border is thin, while the posterior border is thick. Okay. Next. Next is coronoid process. It is flattening triangular upward projection from the anterior superior part of the ramus. Okay. And condylar process, it is strong upward projection from the posterior superior part of the ramus. Okay, anteriorly there was coronoid process, posteriorly condylar process. Next we are going to the attachment and relations of the mandible on the lateral surface. From the oblique line we have seen on the outer surface of the body of the mandible. Here origin of buccinator, and in front of this depressor labii inferioris and depressor angularis below the mental foramen. Okay, these are muscles of facial expression. Okay, all these are included within muscles of facial expression. An incisive fossa gives origin to mentalis and mental slits of orbicularis oris. These are also included in muscles of facial expression. Next, whole of the lateral surface of ramus except the posterior superior part provides insertion of masseter. Masseter is muscle of mastication. There are four muscles of mastication: masseter, okay, medial and lateral pterygoid and temporalis. These are the four muscles of mastication. So one you are getting here masseter on the lateral surface of the ramus. If you place the teeth like this, you can feel the hardening of the masseter here. Okay. To locate the facial artery, you have to see the masseter. You have to draw in surface marking the facial artery, facial vein like this. Okay. During that time, you have to locate the masseter here. Okay, that's why it is important, location of masseter. Posterior superior part is covered by the parotid gland. Okay. Next, lateral surface of the neck provides insertion to the lateral ligament of the temporomandibular joint. Here, the head of the mandible joining with the temporal fossa to form the temporomandibular joint. The parts of both the inner and outer surfaces just below the alveolar margins are covered by the mucous membrane of the mouth. Okay, the alveolar process teeth are lying just below the teeth. The red portion you can see, and that part is known as the mucous membrane, covered by mucous membrane. Next we go to the platysma. Platysma is inserted into the lower border of the mandible. Okay, platysma thin sheet of muscle covering the neck. Okay, so this is inserted in the lower border of the mandible, whole of the lower border of the mandible. Some fibers are extending also into the face up to the angle of the mouth. The deep cervical fossa or investing layer of deep cervical fossa, this is deep fossa of the neck. Okay, it has three layers: investing layer of deep cervical fossa, pretracheal fossa, prevertebral fossa. Here we are getting the outermost one, that is investing layer of deep cervical fossa, that is attached toward the base of the mandible. Okay, attached to the whole length of the lower border. Next, here you can see this is platysma attached over the base of the mandible. Here in the oblique line, here is location of buccinator muscle. Okay, this is masseter, external surface. You can see this is masseter, here is temporalis. Okay, so two muscles of mastication you are getting, and here is mentalis, depressor labii inferioris and depressor angularis. These are three muscles of facial expression. Platysma is lying over the neck. Okay, buccinator is also muscle of facial expression. Next, on the medial surface, you have seen digastric fossa previously. Digastric fossa arises anterior belly of digastric. Genial tubercles, from the superior genial tubercle, genioglossus, from the inferior genial tubercle, geniohyoid. Mylohyoid line, mylohyoid muscle, and from an area above the posterior end of mylohyoid line arises the superior constrictor muscle of the pharynx. Okay, this is three constrictor muscles: superior, middle, inferior constrictor muscles. Superior one is arising from here. Okay, understood? Next is pterygomandibular raphe. It is attached immediately behind the third molar tooth in continuation with the origin of the superior constrictor. Okay, behind the third molar. Next, below and behind the mylohyoid group, there is insertion of medial pterygoid, another muscle of mastication. Okay, insertion of medial pterygoid. At the apex of coronoid process, temporalis is inserted. You have seen in previous picture. Apex of coronoid process. This is frequently asked in your Bible. Temporalis. Okay, coronoid process, attachment of temporalis muscle. Extend downward on the anterior border of the ramus, and into the pterygoid fovea, insertion of the lateral pterygoid. Okay, here pterygoid fovea is lying near the condylar process, anterior margin of the condylar process. So here is the insertion of lateral pterygoid. So we have seen attachment of all the four muscle of mastication in the mandible. On the lateral surface of ramus masseter, here you can see temporalis, coronoid, tip of the coronoid process, medial pterygoid, we have below and behind the mylohyoid groove, medial pterygoid, and lateral pterygoid in the pterygoid fovea near the condylar process. Okay, and sphenomandibular ligament, it is attached to the lingula. This is also important for Viva. Okay, lingula is the bony projection guiding the mandibular foramen and gives attachment to sphenomandibular ligament. Okay, understood? Next. So here you can see this is masseter near the coronoid process. Here the medial lateral pterygoid. Okay, near the pterygoid fossa. Here is the medial pterygoid. Okay, there is mylohyoid line. Okay, so this is the look, and here is anterior belly of digastric, genioglossus, geniohyoid. So these are the attachment of different muscles. Next we go to the mental foramen. Mental foramen transmits the mental nerve and vessels. Mandibular foramen, it transmits the inferior alveolar nerve and vessels. They enter the mandibular canal via this mandibular foramen. Mylohyoid nerve and vessels lie in the mylohyoid groove, just below the mylohyoid line. Next, the lingual nerve is related to the medial surface of the ramus in front of the mylohyoid groove. Okay, and the area, these different nerves in relation to the mandible, all these are important for your Viva. Inferior alveolar nerve entering into the mandibular foramen. Through the mental foramen coming out the mental nerve and vessels. Okay, and this near the neck, other nerves are related. In the mandibular notch, mesenteric nerves and vessels are passing, and near the neck, this lingual nerve is related, and another is auriculotemporal nerve, that is also related to the mandible. Lingular nerve is related to the medial surface of the ramus in front of the mylohyoid groove, and the area above and behind the mandibular foramen, it is related to inferior alveolar nerve and vessels and maxillary artery respectively. The mesenteric nerve and vessels pass through the mandibular notch, and the auriculotemporal nerve is related to the medial side of the neck of the mandible. Okay, this is asked in your Viva. Auriculotemporal nerve, mesenteric nerve, inferior alveolar nerve and vessels, maxillary artery. Okay, all those are important. Lingual nerve. Next we go to the blood supply. Okay, so you have to know the presenting parts, different muscles, and these nerves related to the different foramens like this. Okay, different nerves and vessels related to the mandible. That you must read. Okay, very frequently given bone in your Viva. Next, go to blood supply of the mandible. Central blood supply is via the inferior alveolar artery, except the coronoid process, which is supplied by the temporalis vessels. Peripheral blood supply is via the periosteum. Periosteal supply, which generally runs parallel to the cortical surfaces of the bone, giving off nutrient vessels, and those penetrate the cortical bone anastomose in the branches of inferior alveolar artery. Okay, so internal aspect, inferior alveolar artery, and outer aspects from the periosteal vessels. Okay, next we go to the nerve supply of the mandible. It is basically derived from the mandibular branch of the trigeminal nerve. Trigeminal nerve has three branches. Okay, third one is mandibular, ophthalmic, maxillary, and mandibular. Okay, fifth cranial nerve is the trigeminal nerve. So The long buccal nerve, the anterior division of the mandibular nerve, it supplies the mucosa opposite the last three mandibular molars on their buccal aspect. Another is inferior alveolar nerve, the posterior division of mandibular nerve supplies lower jaw teeth, lower lip, buccal mucosa from the incisor to premolar and the skin over the chin. And the lingual nerve, the posterior division of mandibular nerve, it gives sensory supply to anterior two-thirds of the tongue and the mucosa of the lingual aspect of the lower teeth and the floor of the mouth. So this is supply of lingual nerve. Okay, nerve supply of tongue is very very important even in your theory. Okay, also asked in your biology. So anterior two-thirds of tongue is sensory supply is from this lingual nerve that you must remember. Next we go to the lymphatic drainage. Most of the mandible and lower teeth drain into the submandibular group of lymph nodes, except a small wedge in the symphysis region and the lower incisors, which drain into the submental group of lymph nodes. From the submental group, the lymph drains to the submandibular group of nodes, and most of the submandibular nodes ultimately drain to the jugulo-omohyoid group of deep cervical lymph nodes. Few extremely posterior submandibular nodes drain to the jugulo-digastric group of deep cervical lymph nodes. Okay. Next we go to 8 changes. 8 changes in mandible comes in your short note in theory paper. It is important for your theory, also important in Viva. Viva mainly these parts and different relations, attachments are asked. This is important mainly for theory and can also be asked in your paper. So 8 changes at birth. The body of the bone is mere cell-like, containing the sockets for 2 incisor, 1 canine, 2 deciduous molar, imperfectly partitioned off from one another, and the mandibular canal is of large size and runs near the lower border of the bone, and the mental foramen opens beneath the socket of the first deciduous molar teeth. Okay, so it is near the alveolar border, the mental foramen in at birth, and the angle, and this angle mainly changes. Okay, angle is obtuse, about 175 degree at birth, and the condylar process is nearly in line with the body. Coronoid process is a comparatively large size, project above the level of condylar process. Okay. Next, see this is mandible at birth. Okay. See this is coronoid process is above, then the condylar process, and angle is obtuse, almost 175 degree. Okay, this is not actually that much. Next we go to the childhood. Gradually the angle will decrease. Okay, and condylar process will be getting at same level and then above the coronoid process. And location of mental foramen will also change. So the 2 segments of the bone become joined at the symphysis from below upward in the first year, by trace of separation may be visible in the beginning of the second year near the alveolar margin, and the body becomes elongated in its whole length, but more especially behind the mental foramen to provide space for 3 additional teeth end up in this part. The depth of the body increases owing to increased growth of the alveolar part to afford room for the roots of the teeth. Okay. The angle becomes less obtuse owing to separation of the jaws, while the teeth about the 40th year it is about 140 degree. Okay. Next. So at birth the angle was 175 degree. Then the angle is gradually decreasing. At 14 years of age, it is becoming 140 degree. Okay. So this is in childhood. See the angle is decreased. Condylar process is raised above. Alveolar process, the growth has occurred. So mental foramen is lying at mid-line between the alveolar border and the lower border. Okay. Next, in adults, after the eruption of permanent teeth, mental foramen lies midway between the upper and lower borders of the bone. Okay. And growth of the rami takes place posteriorly and vertically by the process of remodeling. Remodeling means some part is reabsorbed, some part bone formation is occurring. Okay, like this the growth occurs. So posterior growth accommodates the eruption of permanent molars and reduces the angle of mandible to about 110 to 150. Okay, in childhood there was 140 degree. It is gradually decreasing in adults. Adults it is becoming 110 to 150. And vertical growth allows the condylar process to lie higher than the coronoid process. Okay, so this is also important, but condylar process will be higher than the coronoid process. Next, see here, this is condylar process, this is higher than the coronoid process. In this bone it is much projecting, but generally it is more higher. Okay, and see the location of mental foramen. Main is this angle. Angle here you can see 110 to 150. And mental foramen is located midway between the alveolar border and base of the mandible. Next. Next, in old age, again the angle will increase. From adult, the angle again becomes obtuse about 140 degrees because the ramus becomes oblique. And the mental foramen and the mandibular canal are close to the alveolar border. Okay, it will be close to the alveolar border because teeth are falling and alveolar margin is reabsorbed. That's why the upper part is destroyed, so the mental foramen is lying near the alveolar border. And teeth fall out and the alveolar border is absorbed so that the height of the body is markedly reduced. Okay. Next. See, this is in old age. Here you can see angle is again become increasing 140 degree because the ramus becomes oblique. And this is mental foramen. Teeth has fallen and alveolar borders are reabsorbed. So the mental foramen is reaching almost up to the upper margin of the body. Okay, understood? Next. Next we go to the applied aspects of the mandible. So here parasymphysis region. Parasymphysis means on the two sides of the symphysis mandible. That region is known as parasymphysis region. It is lying lateral to the mental prominence and it is a naturally weak area susceptible for parasymphyseal fracture, and it is because of the presence of incisive fossa and mental foramen here. Okay, that's why it is weak area, high chance of fracture. And the body of the mandible is considerably thicker than the ramus, and the junction between these two portions constitutes a line of structural weakness. Okay. Okay, so another weak point is junction between the body and the ramus, high chance of fracture. And strength of the lower jaw varies with the presence or absence of teeth, and the presence of impacted lower third molars or excessive long roots of canines make the area more vulnerable for fracture. Okay, roots are, if they are more deeper, then it will be more vulnerable for fracture. Next, with the advancing age, the loss of teeth and reabsorption of alveolar bone leads to a decrease in vertical height of the mandible, making it prone to fracture. And the slender neck of mandibular condyles renders it particularly liable to fracture as a result of direct violence applied to the chin. Okay, if blow is given in the chin, there is fracture near the neck of the mandible. And this acts as a safety mechanism, as fracture of the neck of the condyle prevents injury to the middle cranial fossa. Okay, middle cranial fossa, brain is lying there over there, important areas of brain. Okay, so it prevents injury to the brain and middle cranial fossa. And direct blow to the chin region can lead to a fracture of one or both condyles. Sideways blow can bring about fracture of opposite condylar neck along with parasymphysis fracture at the same side of the blow. Okay, if you blow comes from the lateral side here will be parasymphysis region, there will be fracture, and opposite side neck of the mandible. Okay, near the condylar process, fracture will be on the two sides. Okay. So sidewise blow can bring about fracture of opposite condylar neck along with parasymphysis fracture at the same side of the bone. And it is possible to split the ramus of the mandible in sagittal plane bilaterally, thereby correcting the micrognathia. This procedure is called sagittal split osteotomy. Micrognathia means mandible is smaller inside. Okay, in that case, osteotomy is done here in the middle where the two halves are joining. Okay, and bone tissue is replaced here so that bone growth will occur and it will attain its original length. Okay, so this is done in micrognathia. And osteomyelitis of mandible is more common than the maxilla, as maxilla has rich blood supply. Okay. Osteomyelitis means infection. If there is rich blood supply, it will help in resolving of the infection more faster. That's why the mandible is more common involved in osteomyelitis. Okay, next. Okay, that's all. So this is a single bone. This part is known as the body of the mandible, and these are the two ramus of the mandible. These are the two processes. This is coronoid process, this is condylar process, and these are the alveolar processes. Alveolar process is having the teeth, okay, and this is mandibular notch. Here you can see the above the mylohyoid line. Here is the sublingual fossa. Below the mylohyoid line, here is the submandibular fossa. Okay, in the midline, here is the four pairs of tubercles. These are the genial tubercles. Superior genial tubercle gives origin to genioglossus. Inferior genial tubercle gives origin to geniohyoid. And here is this depression, oval shaped depression is the digastric fossa. Okay, digastric fossa gives origin to the anterior belly of the digastric muscle. Okay. Okay, this is angle of the mandible, junction between the inferior border and posterior border of the ramus of the mandible. And this is a mandible of the adult. Okay, so that's why the angle you can see 110 to 115 degree. Okay, and you can see the condylar process is at same level with the coronoid process, or it will be higher. Okay, and condylar process is known as the head of the mandible, and this constricted part just below the condylar process, this is neck of the mandible. Okay, and this notch is known as mandibular notch. Through it passes the mesenteric nerves and vessels. Here is the on the lateral side of the ramus. Here is attachment of the masseter. Okay, here is the temporalis on the coronoid process, and here near the pterygoid fossa, here will be insertion of the lateral pterygoid, and on the inner aspect this rough area for the medial pterygoid. Okay, so these are the four muscles of mastication: masseter, temporalis, lateral pterygoid, medial pterygoid. And muscles of facial expression, here will be the buccinator muscle, here will be the levator labii inferioris, levator angulioris, all this, and near the symphysis menti, here will be the mentalis. Okay, and on the inner aspect you will see the inferior constrictor muscle of the pharynx, and along the mylohyoid line will be the mylohyoid muscles. Okay, and this is mylohyoid groove. Just below this mylohyoid line, here is the mylohyoid groove, and here lies the mylohyoid vessels. Okay, and this through this mandibular foramen enters the inferior alveolar nerve and vessels. Okay, and they are dividing within the body of the mandible, and one branch is mental branch, which is coming out through this mental foramen, and other branch is incisive branch supplying these incisor muscles and other tooth of the lower jaw. Okay, understood? And how will you hold it in anatomical position? You hold it with your two hands, index and thumb, and hold the condyles of the mandible like this. Okay, so symphysis menti will be facing anteriorly, condylar process posteriorly, and this convex surface is anteriorly. Okay, and ramus will be posteriorly placed. Okay, understood? So this will be the anatomical position of the mandible, and this condyle of the mandible, it will articulate with this fossa. See, this fossa you can see in the temporal bone. This bone is temporal bone. Okay, and
This is mastoid process. From the mastoid process, posterior belly of digastric is coming. And here is the temporalis fossa. Temporalis fossa here articulates this condyles of the mandible, forming the temporomandibular joint, which is highly mobile. Okay, temporomandibular joint. And in the applied aspect, you have read during side-wise blow, there is fracture in this side, parasymphysis area, other side they are in the neck of the mandible. Okay, the force is distributed like this. That's why the fracture is occurring. So here is one weak area. Here is another weak area. Junction between the body and the ramus. Another weak area is neck region. Okay, and this neck fracture prevents injury to the middle cranial fossa. See, these are the anterior cranial fossa. Here is middle cranial fossa. This is posterior cranial fossa. So just below this middle cranial fossa, this mandibular temporalis fossa is located where the mandible is articulating. So if fracture occurs in the neck, the blow will not reach towards the cranial fossa, middle cranial fossa. Okay, understood? So you will be able to hold it in anatomical position. This will be the anatomical position. It has two main parts. One is body and two rami. Okay, body has the external surface, internal surface, superior border or alveolar border, inferior border or base. Ramus to ramus have, it is flattened quadrangular, external surface, internal surface. Superior border has a mandibular notch, inferior border continuous with base of the mandible. This is posterior border, it is rounded, anterior border is sharp. Okay, and on the inner aspect you will see the mandibular foramen, very frequently asked in your fiber. Mandibular foramen guarded by the lingula. This bony projection is the lingula. Genial tubercles are asked also. Okay, so you read the attachments, different ligaments, muscles, all those, and this will be the anatomical position. Okay, understood? And you also will be asked to articulate. So you will articulate like this with the temporal fossa of the temporal bone. Okay, understood? So this is temporomandibular joint. This is also important for your theory. This will also be discussed in your lecture class. Okay, temporomandibular joint. Its movements comes in your theory. Okay, understood?